Hi guys, I'm Trudy. Welcome back to my YouTube channel. Today I want to do a comparison between occupational therapy and physical therapy. A lot of people still confuse OT and PT, and for prospective applicants who might be torn between the two, this video will give some insights on which to pursue. In this video, I will discuss the differences between OT and PT and what are the main points to consider if you're torn between the two. Also, please remember to subscribe to my channel and click the bell so you get notified every time I post a new video. Now let's get into the video. Now let's talk about the difference between OT and PT. To describe the differences between OT and PT, most people will say OTs work on upper body and fine motor, while PTs work on gross motor and lower body. While there is some truth to this, it is not the whole picture of what OTs and PTs do. Now, physical therapists teach patients how to prevent or manage their conditions so that they will achieve long-term health benefits. In addition, PTs work with individuals to prevent the loss of mobility before it occurs by developing fitness and wellness-oriented programs for healthier and more active lifestyles. Occupational therapy, on the other hand, is the only profession that helps people across the lifespan to do the things they want and need to do through the therapeutic use of occupations. Occupational therapy practitioners enable people of all ages to live life to its fullest by helping them promote health and prevent or live better with injury, illness, or disability. Now, in addition to occupational therapists and physical therapists, there are occupational therapy assistant and physical therapist assistant. In terms of education requirements, OTs require a master's degree, while PTs require a doctorate. For OTA and PTA, both require an associate's degree. In addition, both disciplines have to successfully pass the boards in order to practice. In addition, both programs are very competitive, so having a high GPA is equally important to both. In terms of settings, both OTs and PTs work in similar settings, which includes but not limited to hospitals, schools, outpatient clinics, skilled nursing facilities, home care, just to name a few. In terms of supervision, both OTs and PTs supervise assistants. The level of supervision, however, is not the same. For OTs, it may include direct face-to-face contact and indirect contact. Examples of supervision that involve direct face-to-face contact include but not limited to observation, modeling, co-treatment, discussions, teaching, instruction, and video teleconferencing. PT, on the other hand, must be on site, which means the supervising PT is physically present in the same facility and is readily available to supervise the PTA. Typically, for most facilities, the OTA can clock in at whatever time, whereas the PTA usually have to wait until their supervisor is physically present in the building before they can clock in. In terms of roles and responsibilities, both OTs and PTs screen, evaluate, and treat patients. In addition, both OTs and PTs supervise assistants. The supervision, as stated before, is a little different in that OTs don't have to provide on-site supervision to OTAs, whereas PTs have to provide on-site supervision to PTAs. Now, depending on the setting, the role and responsibility might be different. And what I mean is that what is the main focus in school is not necessarily the main focus in a skilled nursing facility. Now, let's talk about direct access. Direct access means the removal of the physician referral mandated by state law to access service for evaluation and treatment. For physical therapists, every state, the District of Columbia, and the U.S. Virgin Islands allow for evaluation and some form of treatment without a physician referral. However, many of those states continue to impose arbitrary restrictions on direct access, or only allow for treatment without referral under very limited circumstances. Now, OTs, on the other hand, as of now, most states do not allow direct access to occupational therapy services, which means the majority of OTs must rely on physician's referral. In a nutshell, PTs allow for more direct access than for OT. Now let's talk about the boards. While there are unlimited attempts to retake the OT boards, there are still some stipulations. If you fail the boards and you're retaking it for the second or third time, you're allowed to retake it after 30 days. If you're retaking the test for the 4th through 6th time, you're allowed to take it after 60 days. If you're attempting the test for the 7th or more time, you have to wait 6 months before you can retake the exam. For PTs, you have a lifetime limit of 6 times to take the PT exam meaning if you fail on your first try, you have 5 more attempts. You are only allowed to retake the PT boards a maximum of 3 times in each 12-month period, granted if you didn't pass on your first attempt. Another important point when it comes to PT is if you receive 2 very low score on the exam, meaning 400 or below, you will not be able to retake the test again. Now, to summarize everything, OTs have unlimited time to retake the boards, whereas PTs have a maximum limit of 6 times. In terms of salary, according to the Bureau of Labor and Statistics, the average annual salary for an OT is $84,000, and for a PT, $89,000. For an OTA, $61,000, and for a PTA, $58,000. As you can see, PTs on average make more than OTs, whereas OTAs on average make more than PTAs. That's it for this video. Thanks so much for watching. Please remember to like, comment, and subscribe, and share this video with someone who you think it might help. Also, click the notification button so you get notified every time I post a new video. I post a new video every Sunday. I hope if you are torn between OT and PT, this video shed some insight and give you more clarity on which to pursue. Hope this video was helpful. Thanks so much for watching, and I'll see you in the next one.